going to go through the process of accessing a Mediport. The supplies that you will need are the Mediport dressing change kit, a Huber needle or a power needle, depending on which type of Mediport your patient has. So you can see Power Lock says power is the power injectable needle, and then the Safe Step is the Huber needle, the regular non-power injectable needles. You also will need to add sterile gloves and a mask, and anybody in the room will also have to wear a mask while you are doing this. The first thing we're going to do is actually decannulate the Mediport, and then I'm going to do a dressing change where you recannulate the Mediport. So before you decannulate, you have to actually flush your line with 10 mLs of normal saline and 3 mLs of heparin, 100 units per ml. And then after that's done, you're going to make sure that your area is clean, you have non-sterile gloves on. You're going to take the adhesive remover wipes or spray and go around the edges here. The dressing nice and loose. Want to prevent any skin tears, so you just want to make sure you do use adhesive remover for any of your dressing changes. Okay, and this Huber needle, it does have a safety mechanism. This is one of the regular non-power needles, but the power needles also have a safety mechanism. So you're going to take your non-dominant hand and stabilize the disc flat against the chest, and with your dominant hand you're going to pull the safety mechanism towards you. You'll hear a click, and you can remove it, and you can see the biopatch is still there, but the needle has been retracted. Sometimes you can put a band-aid over the spot if it's bleeding just a little bit, but a lot of times it's pretty intact. So at this point, if you have a patient coming in and they need it to be accessed, you're definitely going to wash your hands and get all your supplies like I had mentioned before. So this patient that we have has a regular Huber needle, and it's a 19 gauge 1 inch. You want to make sure you have the exact length and type of needle to be successful. I'm going to open everything really quick here. Everybody in the room puts on a mask. Make sure your area that you're working in has been wiped down and it's clean. I'm going to drop everything onto your sterile field. Opening everything really quickly so you can see. I'm going to open up my kit here. And what is inside your kit? You have your flush, your sterile flush may or may not be inside the kit. It may be attached to the outside of your kit, so if it's a kit that has one in there, it'll be in there. If it's attached to the outside of your kit, you're just going to drop that in. You do need to use a sterile, normal saline flush. So I'm going to drop that in my kit. I'm also going to drop in my access needle that I need to use. And once everything is dropped into my field, I'm going to put on my sterile gloves. Let's put that over. Your gloves on, one hand at a time. I usually will take off my watch. Anything that you can to prevent infection, that's recommended. Alright, I'm going to move this out of my way since it is sterile to touch in the center. I'm going to connect all my pieces really quickly here. So I have my Huber needle. I have a drape, my skin protectant, my cap, my biopatch, my chlorhexidine, and my dressing. So the first thing you want to do is assemble everything. So your cap has to be attached to your Huber needle. So it's one piece here. Then you're going to take your sterile normal saline that you opened onto the field and flush it. So we're going to just prime the needle, making sure it's primed. The biopatch also has to be part of this process. So there's one of two ways of doing this. You can, in advance, you can place it on top of this access needle. You want to make sure the blue side is up when you do access, and I'm going to show you how to hold that the best way when you access. Another way is after you've accessed to slide it under. So the first thing we're going to do is we're going to clean. I do want to point out that there's a sterile drape in your kit. It's recommended to use this if you have a kid that has a lot of tubes or different things going on that could be a risk for infection. You can lay it, if the child's laying down, you can lay it over their belly, or if it's a teenager, you can actually set it on their shoulder. It just gives you more room to work, and it makes your sterile field larger. So I'm going to simulate that this is a baby or a child that's laying down, so I'm just kind of setting that there. We're going to clean. So we know that I've already palpated the port. I know where the port is, and I know what needle size I need. So I'm going to go ahead and clean. So you start from the insertion site in the center, and you work your way out with a little bit of friction. You clean for 30 seconds, just going a little bit outside the border here of the dressing. And you're going to let that dry for about a minute or so. You're going to discard your cleaner off of your sterile field and make sure that it completely dries. You can kind of get yourself ready here to access. One way you can hold your needle, you have to take the safety off. You can hold it in such a way that you have your thumb on the safety and your pointer finger, your middle finger securing the biopatch. So when you go in, everything's kind of staying together. You can hold the syringe in your pinky. Another reason the drape is there is you can set the syringe on the drape while you're accessing, so everything still stays sterile. You do not want to drag things across the bed because you don't know what germs are in the bed. So a minute's gone by. I can feel the borders of my Mediport, and I'm ready to access. So you're going to go straight in the center of the port. Then go straight in. You're going to feel the back of the port, so it feels like you're putting like a safety pin in a eraser. So it's pretty well seated in there. You're going to withdraw, and you're going to get bright red blood return in here. Not today, but normally you're going to get bright red blood return. Then you're going to flush your needle here. So all the way through you're going to flush. And then I'm going to put my dressing on. So I'm going to use my skin prep. I'm just going to go around the border of where that dressing is going to lie. Just once around. And then I'm going to apply my dressing. It's similar in shape to the other dressing that we use in the hospital. So it has 3 pieces. It has the big window, the under piece, and then the top piece. It's all connected, so you take the backing off. And you're going to center it. You're not going to stretch it at all. You're just going to kind of gently place it down, trying to prevent any pleating if you can. It's a little hard because it is an elevated device. And you're going to put the tubing kind of in that slit. Work your way from the center out to smooth down the edges. You're going to take off the border and smooth it out. And then you're going to put the last 2 pieces on. So the under piece here goes under. Smooth that out. And then the small piece goes on top to kind of seal in the any section that could allow any air in there. So you're just going to kind of seal in the junction of the other 2 stickers, and then you're going to put the date on there and your initials.